Panchakarma is the hottest keyword used when it comes to a Google search about Ayurveda. Just like the detox and rejuvenation, Panchakarma would be the most used and probably the most misused word by hospitals and clinics across the world. I'll tell you why. Many claim that they do the whole Panchakarma therapies in a week's time. Is it really a genuine offer? Well, the literal meaning of Panchakarma is the five therapeutic procedures. Many patients think that every other Ayurvedic treatment procedures like Abhyanga or oil massages, Kiris, Pirichil, etc. are the real Panchakarma. They pay for such packages with disguised and misleading names. Those therapeutic procedures could be a part of Panchakarma, but they are not the actual Panchakarma. Or calling such packages as Panchakarma is quite not fair. First of all, most patients would not really require the whole five procedures in Panchakarma for a cure or for a general detox. If at all they need it, it would take not less than a month to perform them in the right way. And if you count all the variants, there would be more than 100 therapeutic procedures typically performed in an Ayurvedic hospital. But what makes Panchakarma stand out from the rest? Why it takes a lot of time and preparation? Let's find out. This is Dr. Sriraj here with a frequently asked question about the details of Panchakarma treatments. On the basis of how a doctor manages the aggravated doshas or toxins in your body, the treatments in Ayurveda are divided into two, named as Shodhana and Shamana. Let's see the difference between them. Shamana. In this variant, the toxins are kind of suppressed within the body itself. It is usually done in situations where the patient is having less amount of toxins in the body, when there is only a short-term history of illness, when there is minimal or tolerable symptoms, when the ailment is not quite advanced, etc. It only needs less time, less preparations, less restrictions, less money, less attention, less nursing assistance, etc. And they can be sometimes be done at home too. But there is a catch. You'll get it when you know what is Shodhana treatments. In the Shodhana variant, the toxins or the disease-causing factors in the body are forcefully precipitated and then agitated to dislodge them from their location and flushed out of the body through five means called as the Panchakarma. And in this method, even a chronic illness with very bad symptoms are managed pretty well. This is usually done when the patient has more toxins in the body with multiple symptoms bothering them. Opposite to the Shamana treatment, it needs more preparation, more diet and activity regulations. It requires hospitalization, more of attention, and nursing assistance, which makes it relatively expensive too. But the results are quite long lasting, and it gives you nourishment and rejuvenation to the body along with the regular detox. Now, what are the Panchakarmas in the first place and why it is done? They are the first one, Vamana, the emetic procedure in which you are induced to vomit the excess toxins after a series of preparations. This is the best for treating illness caused by Kapha dosha. The next one, second one is Virechana, in which you are given laxatives to purgate you physiologically to flush out the toxins. This is considered to be the best treatment for Pitta-related illness. The next one, the third one, is called as Vasti or medicated enemas, given through the rectum, and it is to clean up the excess vata in a person. There are many variations to this treatment depending upon the condition of the patient. And then, as the fourth one, there is Raktamoksha or bloodletting, in which the aggravated toxins in the blood are drained through various methods like puncturing a vein or using syringes or by leaching or suction methods, etc. Then the last one is Nasyam or the nasal medication to eliminate the excess toxins through the nostrils. This is generally given in ENT conditions or sinusitis or in migraines, etc. or for cervical problems. The last two are mostly localized elimination methods. So among those, the first three require more preparations and time than the rest. Except Vamana, all the rest of them have a mild or light variant as well, which can be done in a clinical level too. But the real pro variant should be done only admitted in a hospital. Now, the next question is, why it takes so much time? Like in modern medicine, every operative procedure needs a pre-operative and post-operative procedure before and after the main procedure. Panchakarma also require them before and after. Although those toxins are unwanted things which is in excess in body, they are still a part of the body, at least for the time being. So plucking them from the root should not be done as simple as nibbling a weed from a farm. For an example, in an ascites patient, the excess liquid from the abdomen is not completely tapped in a day. If you tap more than a certain amount of liquids from the body, you could get a hypovolemic shock. Similarly, you cannot drain a not so matured abscess or even extract a tooth without preparing it for the procedure. We have snehana, which means application of oils externally or internally or both to precipitate the toxins in their locations. Oil massages, snehapanam, pirichil, etc. could be used as a tool for that. And then you undergo svedana or sweating process, in which different kind of heating methods are used to make you perspire. Treatments like steaming, different types of kiris, application of sunlight, smoke, etc. could be used for this. Doing all these stunts in the right way definitely takes its own time. Now, how does it even work? Well, it cannot be proved like the way they prove how a toilet wash is killing 99% bacteria. But it really cures millions every year, at least in India. As I said earlier, the agitated toxins, after different types of oil applications, are then dislodged from its locations with the sweating and heating methods and later redirected either to the main GI tract or near to the respective orifice for the propulsion or elimination by any one of the Panchakarma process. So the chances of a recurrence is much less. And that's pretty much everything about the Panchakarma. I guess you got my points. And in case if you have any questions, you are free to ask in the comment section. And I'll see you with another one soon. Until then, stay safe and take care. Bye-bye.
Riga passa, passa.